Hi everyone, this video presentation will focus on the timed up and go test as well as some aspects of the manual version of the timed up and go test, otherwise known as the TUG test. The TUG test is designed to assess balance, functional mobility, gait, and vestibular areas in the geriatric population or those who are 65 and older. It is an observational type assessment that should take less than 3 minutes and is included in the ICF domain of activity. Diagnoses or conditions that can be assessed with the TUG test include arthritis and other joint conditions, cerebral palsy, multiple sclerosis, Parkinson's disease, spinal cord injury, stroke recovery, vestibular disorders, and brain injury. This assessment requires a standard armchair, a stopwatch, tape, a tape measure, and enough space to measure out 3 meters. The administrator measures the time in seconds for the individual being tested to stand from a chair, walk 3 meters, or about 10 feet, turn around, walk back, and sit again at their comfortable pace with their normal footwear and usual assistive devices. Some other notes regarding the setup of the administration of the TUG test suggest that the individual must be seated in the chair with their back against the back of the chair. The chair must also be freestanding away from the wall. The client should have one practice child that is not included in the score. Here is a quick demonstration of the TUG test.
On the word go, you're going to stand up, walk to the line on the floor, turn around, come back, and sit down in your chair. You're going to walk at your normal pace, okay? Okay. Go.
The manual TUG test is considered a dual-task dynamic measure to identify individuals who are at risk for falls and to assess aspects of cognition. This version includes the same process of the normal TUG test, but the individual also carries a full glass of water in one hand that has been placed on a table next to their chair. The individual must place the cup of water back onto the table as he or she sits down. This version is typically used for community-dwelling elderly, vestibular disorders, and Parkinson's disease. Here is a quick demonstration of the manual version of the TUG test. As you can see, the manual version of the TUG test is set up the exact same way as the normal TUG test. The only new part of this version is the addition of the side table and the glass of water that the individual has to carry. For this assessment, there are no standardized scores. However, performance on the TUG test is rated on a scale from 1 to 5, where 1 indicates normal function and 5 indicates severely abnormal function, according to the observer's perception of the individual's risk of falling. There are also cutoff scores to indicate the risk of falls in a variety of populations. These scores portrayed on the slide have been taken from studies completed within these specific groups or diagnoses. This chart includes the normative data based on specific age ranges and the use of an assistive device. Since there are no standardized cutoff scores, some researchers have also established interpretations of the time score that an individual receives. For example, if a person receives a score less than 10 seconds, it suggests that they are completely independent with or without a walking aid for ambulation and transfers. If they score less than 20 seconds, they are independent for main transfers. And if they score more than 30 seconds, they require assistance and may be dependent in most activities. Here is one example of a score sheet that could be used when recording the time taken to complete the test. A note of any assistive devices or difficulties performing the task would be made. The trained professional would also keep track of subsequent times that the individual performs the assessment in order to detect improvements or decline in functional mobility. The TUG test is considered excellent in test-retest reliability for community-dwelling elders, osteoarthritis, TBI, Alzheimer's disease, and stroke. Intra-rater and inter-rater reliability is also considered excellent. The correlation of the TUG test is excellent with the 10-meter walk test, the 6-minute walk test, the Berg Balance Scale, the Walking Index for Spinal Cord Injury 2, and the Spinal Cord Injury Functional Ambulation Inventory. The correlation of the TUG test is adequate with the Barthel Index, the FIM, and the Sickness Impact Profile. The minimal detectable change for the scores of the TUG in those with Alzheimer's disease is 4.09 seconds. For those with chronic stroke, it is 2.9 seconds. For those with Parkinson's disease, it's 4.85 seconds, and those with spinal cord injury is 10.8 seconds. The MCID has also not yet been established for the TUG test. Although there is data that shows this assessment used with individuals who have spinal cord injuries, it may not be an appropriate measurement for this population due to severity of injury. When it comes to scoring the TUG test, some researchers have actually advocated for use of a mean time from 3 successive trials due to potential learning effects. Very frail or weak elderly with poor mobility may take much longer than the suggested cutoff scores. There is also less reliability in this assessment among those with cognitive impairments. However, it can be easily used by any cultural group due to the test's simplicity in administration and does not require any specialized equipment. The test can also be administered in different languages with informal translations since there is no standardized score sheet or manual. Well, thanks for watching, and here are the references for the presentation.